In pituitary hormone, first to see about the growth hormone. Growth hormone is a peptide hormone. It is a polar substance. It acts through cell membrane receptor. We discussed in the last video. We see that pathway of that growth hormone. First, hypothalamus. Hypothalamus secrete the growth hormone, release hormone, and it acts on anti-pituitary and release the growth hormone. And target organ is liver. Liver secrete that insulin-like growth factor. Insulin-like growth factor is two types: insulin-like growth factor 1, insulin-like growth factor 2. One is for adults, two is for intrauterine fetus. It is not dependent on the growth hormone, but one is dependent on growth hormone. So it is also controlled by the negative feedback mechanism. Negative feedback means growth factor and growth hormone. It's directly acting on the somatostatin. It is an inhibitory hormone secreted by hypothalamus. It directly inhibits the anterior pituitary, so it is control the growth hormone. It's regulate the growth hormone release. GHRH also has a negative feedback mechanism directly acting on the hypothalamus. It controls the GHRH hormone, so it indirectly controls the pituitary, anterior pituitary. Okay, this is for that hypothalamus pathway. Growth hormone functions are insulin resistance. So it increase the blood sugar level and increase the lipolysis and increase the free fatty acid, and it also increase the protein synthesis and lean body mass, and it also stimulate the chondrocytes, so it increase the bone growth, and it also retain the sodium and potassium levels. Sodium follows the water, so it increases the volume of the blood. So insulin-like growth factor, it acts as a similar kind of functions of the growth hormone. It's only vary from that lipolysis. Growth hormone increases the lipolysis. Insulin-like growth factor anti-lipolysis. Hypersecretion growth hormone has two conditions: gigantism and acromegaly. Gigantism is for adolescents and child, acromegaly for the grown adults. What was the mechanism behind that? It is simple. It acts on the growth plate in the bone. If the growth plate is not fused means it is the bone growth is vertical in this condition. If the bone plate is fused with the bone, it is deposited in the lateral side of the bone. This is the difference between the gigantism and acromegaly. If the growth hormone hypersecretion happens means it directly opposite that function of the growth hormone. It has hypoglycemic because of the insulin resistance. Blood glucose level is raised in that growth hormone. If the growth hormone is hypersecretion means insulin resistant. It is not an hypoglycemic condition. It is a hyperglycemic condition. It represents as type 2 diabetes mellitus. So protein synthesis is down, lean mass is protein synthesis is happening, and lean body mass is increased. Protein synthesis also increased. It resulted in cardiomyopathy, myopathy, and colon cancer risk also there. If the chondrogenesis happens, gigantism, acromegaly is there. If the sodium and potassium levels are increased, means blood volume increase. Blood volume increase means is an what? Blood pressure will increase. That's it. It is a simple way of learning the growth hormone. Then we discuss about the prolactin hormone. It is also similar like an growth hormone. It is secreted in the anterior pituitary. Then we see that pathway of the prolactin. Hypothalamus secrete the prolactin inhibitory factor. It is an dopamine is released. Anterior pituitary has an D2 receptor. D2 receptor is inhibitory in nature. So hypothalamus is secreting that dopamine. Anterior pituitary has an D2 receptor, is inhibitory in action. So prolactin is not secreted. If the dopamine release is low, means the prolactin is secreted. It acts on the mammary gland. Target organ is mammary gland. It stimulates breast development, milk production, maintenance of the milk production is the function of that prolactin hormone. The hypothalamus release inhibitory action. If pituitary stalk is cut, means there is no connection between the hypothalamus and the pituitary gland. So dopamine is not act on that anterior pituitary dopamine receptor, D2 receptor. So prolactin content increase. If the prolactin content is increased, means infertility, amenorrhea, and that kind of adverse effects are there. The prolactinoma happens means the prolactin level increases. It's a mass effect. First affect the growth hormone, then FSH, then TSH, and last only ACTH is affected. And one interesting fact about the growth hormone and the prolactin hormone is it is secreted in the sleep during the non-REM sleep phase. Then we discuss about posterior pituitary. We discuss separately about that TSH, ACTH. This and separate video. Later on we discuss now about the posterior pituitary. The posterior pituitary is a neurohypophysis. The cell body is in the hypothalamus, and secretion happens through the posterior pituitary. The neurons in the hypothalamus produce that ADH and oxytocin hormone, and it secretes through the secreted in the anterior pituitary. That's it. And so it is called the neurohypophysis. ADH receptor has two types, R1 and R2. R1 is again divided into R1A, R1B. R1A is called V1 receptor, R1B is called V3 receptor. R2 receptor is only has V2 receptor. V1 receptor is a vasoconstriction and platelet aggregator receptor. Then V2 is an Val-Miliband factor release and accoparent to receptor in the distal nephron. Disorder of ADH, it is diabetes insipidus and syndrome of inappropriate ADH. It is two types: central diabetes insipidus, nephrogenic diabetes insipidus. It is etiology of SAADH means ectopic production and oxytocin in the large dose. That's all about that ADH, hormone ADH. Then we discuss last topic, oxytocin. Breast, it acts on breast and uterus. It ejaculates milk production. It ejaculates the same sperm by vas deferens contraction, and it is contraction at uterus in that final stage of the labor and facilitate the sperm transport. That's it guys.